Hello and welcome to another episode of the Synapse e-learning series. With us today we have Dr. Michael Borg. Thank you for accepting our invitation.
Thank you for the invite.
Dr. Michael Borg is the head of the Infection Control Department at Mater Dei Hospital. He's a senior lecturer at the University of Malta. He's the chair of the National Antibiotic Committee and the EU National Focal Point on Antimicrobial Resistance and Antibiotic Use. He has also been the chair of the International Federation of Infection Control and he has more than 70 publications in international peer-reviewed journals. Today we are discussing antibiotic resistance in light of the Antibiotic Awareness Day, which is celebrated during this time of year. Dr. Borg, why should we be worried about antibiotic resistance?
Well, because antibiotics are the mainstay of modern medicine. Without antibiotics, it would be impossible to have interventions as critical as intensive care, as major surgery, as the treatment of cancer, because all of these conditions require that the patient is covered for the potential infectious complications that are part and parcel of these interventions. So if we come to a stage, as we were before Fleming discovered antibiotics, then of course we are going to compromise very important parts of modern medicine.
But is resistance a problem in ambulatory care in Malta?
Yes, this is a very good question. I mean, very often we tend to think about resistance in terms of the hospital, and especially in our country in terms of Mater Dei. And whereas it is true that we have a number of challenges in terms of resistance in the hospital, but resistance in the community, in patients, outside of healthcare settings is even a big problem. Just to give some points, for example, about 35% of our E. coli are now resistant to quinolones. About 10% of E. coli are also resistant to all penicillins and all cephalosporins. 40% of all Staph aureus isolates that are sent from community sources are MRSA. 10% of patients who come into hospital, to come into Mater Dei, are already carriers of Staph aureus before they have even set step in the hospital. So clearly, yes, resistance in the community is a major event in this country. It is a major worry, and it is increasing, and therefore it is impacting both on the community itself, but also on the patients who are admitted into the hospital.
And Dr. Borg, from your professional point of view, what do you think is driving the resistance here locally?
Very, very interesting question as well. The drivers of resistance are mainly two. The cross-transmission of resistant organisms, but this is primarily important in the hospital setting, where you have many patients in a small geographical area. And here, of course, we emphasize on things like hand hygiene, on good decontamination of equipment, etc., etc. But in the community, the major driver is antibiotic use. And there are numerous studies now within Europe that show a very high correlation between the level of use for a particular antibiotic group and the level of resistance within that community for that same antibiotic group. So clearly, what I believe is driving resistance in Malta is, of course, these antibiotic practices.
And does that imply that our prescribing practices actually need improving?
The answer is yes. I think we have to be honest about this. There are a number of aspects in prescribing that it is clear need to be addressed. For example, from European studies, we know that whereas in, for example, Scandinavian countries, there are about 25% of people who will tell you that they've had an antibiotic, at least one antibiotic, over a calendar year, in Malta it is twice as much. It is almost half of the population have taken an antibiotic at least once during a year. It is the highest recorded in EU countries. If you look at, for example, the Eurobarometer study that was done a couple of years ago, it showed that about 70% of interviewed Maltese tell you that they have taken an antibiotic for a cold, for flu, or for a sore throat, which of course we know are conditions that are primarily viral in etiology. Another area that I'm very worried about is the use of topical antibiotics. And I can tell you, I get regular requests from the tissue viability unit, which is just across the corridor from my office at Mater Dei, to guide them, because they would have patients coming in from the community with wounds, especially these diabetic wounds, and they would be prescribed a topical antibiotic for a diabetic ulcer, which in itself is extremely incorrect practice, because these antibiotics on these ulcers absolutely are not indicated. So clearly there are many areas that our antibiotic practices need to improve within.
So the Maltese, the local population, is a major consumer of antibiotics when compared to other countries. Why do you think this is the case from a medical perspective?
Well, up to maybe 10, 15 years ago, we used to say, well, because these patients are getting the antibiotics over the counter. But now we know, and I think this is thanks to a lot of the campaigns that the National Antibiotic Committee has done over the past, 5, 7 years, that OTC, that non-prescribed antibiotic use, has fallen tremendously. So whereas maybe in the late 90s it was in the region of 15%, so 15% of all antibiotics were over the counter, nowadays, and we have good data to back this, it is less than 1%. So clearly the emphasis is coming from the prescribed use of antibiotics. Now, why do we have this case over here? Why do we have a higher level of prescription than, for example, countries in the north of Europe? And one of the most interesting hypotheses, which I've been very active in researching, is actually cultural. Cultures vary from one country to another. There is one particular cultural dimension which is called uncertainty avoidance, and countries which are high in uncertainty avoidance tend to be very uncomfortable with ambiguity. And of course, there is nothing more ambiguous than a patient presenting with an infection where you're unsure whether this is viral or bacterial in etiology. And in these cases, what we find is that countries in the north of Europe, doctors there tend to withhold antibiotics. They wait, maybe give a delayed prescription, and even then in usually quite extreme cases, whereas in the south, in the Mediterranean, unfortunately we do tend to be a bit more trigger happy, and we tend to prescribe antibiotics for these conditions. And this, I believe, is a major contributor.
And the problem has been identified over the past decades. A decade and a half ago, as you rightly said, over-the-counter medication has been controlled, and this has become the norm now. Now you're pointing towards a cultural trait which may be contributing to this problem. What do you think should be done to address this current issue?
Well, it's therefore important, especially because, as I said, we are quite high in uncertainty avoidance. We're the second highest country in Europe that has uncertainty avoidance as a high score, that we need to address this by resorting to certainty. And of course, one of the most certain ways in which we can get better in prescribing antibiotics is by referring to guidelines. And the National Antibiotic Committee has produced guidelines locally. These guidelines are being updated within this year, actually. And what we have done is, rather than just provide a very vague guideline, we have produced a number of algorithms. And these algorithms are very easy to follow. They require a yes-no approach in order to go through the clinical condition. And at the end of the algorithm, there is an indication whether antibiotics are indicated or not, and if so, which antibiotic. And it's very important that when we do so, we pay an extreme attention to what type of antibiotics we are prescribing. Because the other big area that we have a very, very major difference as compared to the Scandinavians is in the type of antibiotics that we prescribe. So whereas, for example, in Scandinavia, about 60-70% of antibiotics are very narrow spectrum, such as flucloxacillin, such as penicillin even, locally we tend to go for the broad guns, the big guns, the wide spectrum antibiotics. So what we're seeing from our surveillance of antibiotic use in Malta is that, first of all, this is increasing year on year, so this is already a worrying trend. But the other major worrying trend is that about 70 to 80% of these antibiotics are extremely wide spectrum. The penicillins with beta-lactamase inhibitors, the fluoroquinolones, the wide spectrum cephalosporins. So clearly, there are two areas that doctors need to address. One is that they need to reduce the antibiotics prescribed for conditions which are ambiguous, which are almost likely viral, such as sore throat. a large proportion of antibiotics goes for sore throats, which almost always are viral. And then when we do prescribe, it's very important that we try as much as possible to introduce narrower spectrum formulations. So if you have a skin infection, flucloxacillin is just as good than the wider spectrum formulations. If you have an upper respiratory tract infection, amoxicillin is just as good as the wider spectrum formulations. If you have a urinary tract infection, nitrofurantoin is actually the best drug in terms of susceptibility in this country. So clearly there are options in which we can address the situation.
So Dr. Borg, you've mentioned that the guidelines are there, the information is there, and you mentioned also the role which doctors have to play in addressing this issue. But who else needs to contribute to the final solution?
I mean, at the end of the day, this is a multidisciplinary issue. So all the different disciplines that are involved in antibiotic prescribing and use can play a part. So doctors obviously must drive this because, of course, as we said, the prescribing patterns are what is driving consumption and subsequently resistance. But there are other stakeholders. Pharmacists play a very important role because they have direct contact with the patient and can guide the patient in better use of the antibiotics. The National Antibiotic Committee and also other educational sources in order to keep up-to-date information. And of course the patients themselves, because we need to encourage the patients not to put pressure, because we know sometimes it does happen, on doctors to prescribe. And this is where again the National Antibiotic Committee comes into the picture, and we try, especially at this time of the year, to educate the public not to request antibiotics if there is no indication for them.
Thank you, Dr. Borg, for your time. Thank you for your most valid input in light of the Antibiotic Awareness Day, which we're commemorating during this time of year. We hope that this episode has helped you to further your knowledge on antibiotic awareness, and we invite you to share it with your professional colleagues. Goodbye for now.